You're watching WKRN News 2 this morning.
All right, a special guest here to walk us through a pretty important story here this morning.
It was really a bombshell announcement this morning from the American Cancer Society about when women should be screened for breast cancer.
Right.
And it leaves a lot of questions and a lot of wiggle room in here, and it really makes you, it kind of divides up into a whole bunch of different categories.
Yeah,
it's confusing.
Does. Actually, Dr. Erika Hamilton here with us, the Associate Director of the Breast Cancer Program at Sarah Cannon Research Institute. First, tell us, and just listening to everything out there, I'm a little confused. So tell us exactly what the American Cancer Society is saying.
Yeah,
here.
Thanks for having me. I think everybody's a little bit confused, so it's not just you. There's three things they really changed in the recommendation. First, they changed the year women should start receiving mammograms from 40 to 45. The second is after the age of 55, they recommended women get mammograms every 2 years instead of every year, which was the previous recommendation. And they came out and said that self-exam and routine physical exam in a doctor's office is no longer needed.
Why these changes?
Yeah, I think a lot of us are kind of questioning that. You know, 6 years ago, the U.S. Preventative Task Force changed their recommendation from 40 to 50. There are still large organizations that still recommend 40. So now we have people saying 40, people saying 45, people saying 50. And my worry is that I think, A, we're confusing women on, first off, how important are mammograms, which is still incredibly important, and that we don't really know when and how often they should get them, which I think is kind of a dangerous message to send.
Yeah, and the fact you recommend, what does a canon say?
Yeah, I think that it's not as easy as a blanket statement for everyone.
Yeah.
I personally have seen a lot of women whose lives have been saved, young women, from an early mammogram, and so I still feel that 40 and yearly, unless you and your doctor discuss it and feel that it should be different, is probably the way to go on this.
Now, I know, I guess their research was saying that they have changed this because of false tests or false results, and so that is hindering this. But from your research and what you do, I mean, isn't there just this balance of the ones that are not false, that we do save these lives? There
is a balance, and that particularly drove the reason they're not recommending 40 to 45, is because as women are younger and their overall risk of breast cancer is smaller, we're more likely to find these false positives and have to do a biopsy that turns out to be nothing, right? But I think the difference is that overdiagnosis is not the same as overtreatment. We all know that sometimes we're overtreating women, and we're working on that, but I would much rather know that a woman has an abnormality in her breast and then decide what to do with that, if anything, than to not know that somebody has a cancer that could potentially kill her and be able to intervene.
And I absolutely agree. Absolutely.
There's going to be more on this, obviously, in the coming days, weeks ahead there. But for more information, you guys just go to the Sarah Cannon website.
That would be great.
And that'd be an easy thing to do.
Dr. Hamilton, thank you for joining us.
Thank you for having me.
I really appreciate you getting up this early. I know you're up this early anyway.
I was up this early
You're
anyway.
on call all the time. Okay.
The discussion does continue at the top of the hour. Dr. Richard Besser joins the crew over there at Good Morning America to share his opinion about these new recommendations. So we will be hearing a lot about this. And, of course, October, Breast Cancer Awareness Month as well. So a little ironic there.
And it was a couple of years ago on October that one of the anchors of Good Morning America discovered that she had breast cancer
in a routine
by doing
mammogram.
A story about it. Yeah.
Exactly.
Let's go over to